Hi, I'm Dr. Castanet. I comment on all things spine related. Today I'm going to talk to you about comments that I receive from patients frequently regarding muscle tightness. Muscle tightness is often misunderstood, particularly by young clinicians, I think, who haven't seen this phenomenon tens of thousands of times like I have. Muscle tightness is typically a response to some lesion, and it's a protective guarding response to splint the area and prevent movement of an inflamed and injured area. The injured area doesn't have to be a significant injury. In fact, most injuries are not. But it could be a tweak that inflames some tissue. It often happens to the outer fibers of the disc. It may happen to synovial membrane within the joints. It can happen from nerve root irritation. But once an inflammatory process ensues from some small insult, maybe something as mundane as the way you bend over to pick up a sock, or you do something to twist or lean or something like that, and a little inflammatory process will start. That's perceived by the neurologic tissues surrounding the area. They then initiate a reflexive muscle tightness to contract and splint and protect the area from further movement until the injury has a time to rest and the inflammation subsides. And you may feel the tightness. If it's a low back issue, you could feel the tightness in your low back, in your buttock region, the hamstring muscles themselves, all in an effort to splint and protect the low back area and prevent movement. Oftentimes, this gives rise to a lot of pet theories about the source of the pain, and naturally, patients who feel the muscle tightness may think that's the source and cause of the problem, when in fact that's just the response to the problem. The problem is best treated, and this phenomenon has been demonstrated to me clinically so many times over the years. All you have to do is treat the underlying lesion effectively. You don't address the muscle tightness in the least. You don't treat piriformis issues, you don't treat hamstring issues, you don't treat back muscle issues. You just treat the underlying issue. Typically that's some insult to disc, joint, or nerve. And the best, most effective way to treat these is to decompress the problem that's inflamed. When you do that, it typically reduces the inflammation over the course of the next many hours, several hours to the next day or two. And as the inflammation subsides, the muscle tightness abates on its own without direct address or redress with the tightness. Otherwise, you can chase your tail, treating muscle tightness, massaging it, doing ultrasound, any number of therapies, stretching, all those sorts of things. Stretching, in fact, can even often irritate the causative problem that started the muscle tightness to begin with. So the best thing is to treat the problem, which usually has a compressive nature, whether it is from disc, nerve, or joint. Decompressing these problems, again, reduces the inflammation over the course of the next many hours, and the muscle tightness abates on its own. It just goes away. And that's a demonstration that, in fact, you don't have to treat the muscle tightness. It's a secondary phenomenon. You treat the underlying lesion. Of course, these are all assumed until proven. But if you start with our working assumption and you decompress the lesion and you see this muscle tightness abate on its own, you'll be informed and come to know that, in fact, these muscle tightness issues are secondary phenomena. I would say that's true in the vast majority of the cases, more than 90% of the cases. Sometimes you can have a primary muscle lesion, but I find the best way to tease those out is, in fact, to treat it like it's a compressive disc-related issue or joint-related issue, decompress it, see if that works. If it doesn't work, then you can try addressing the muscle issue directly and see if that provides effective treatment. But again, the vast majority, it's not piriformis issue, hamstring issue, intrinsic to those tissues, low back muscle issue. Those are secondary phenomena, so treat the underlying compressive problem, and the rest should go away on its own. I hope that helps inform you about the nature of these problems, because it does result in a lot of wasted time and a lot of wasted money treating muscular problems that are secondary. If I can help you, I'm Dr. Castanet. I'm in Decatur, Georgia. My phone number is 404-558-4015, and website is backstrong.net. Thanks very much. Bye-bye.